If you want to learn why being a doctor of physical therapy works against you, you need to tune into this episode. Hi, everyone. Welcome back to the podcast. Welcome, all new listeners, and welcome back to those who have heard my content in the past. Uh, don't be a doctor of physical therapy. Be you. If you want to learn why being a doctor of physical therapy works against you, you need to tune into this episode. Before I go on to the podcast, what is happening in life? Let me tell you, life is actually amazing. My wife and I just had a recent date night, and we actually calculated how long it's been since like an official date night without our parents or family supporting us, like an actual babysitter and taking all three kids. It's been over a year and a half. So almost like pre-COVID, pre-third child. Zachary and Alex were around, and Jacob was not in the mix. And so it's been a long time, well-deserved time apart, and just reflections and things to strengthen our relationship. And it's been good. The kids are good. Zach is still in flag football. Season ends really soon. Alex is still crushing gymnastics, and Jacob, my youngest, almost 11 months, is standing and ready to take that first step, but I keep knocking him over because I don't want him to walk. Don't laugh at me. All right, on to the episode. All right, so why am I saying this? So don't be a doctor of physical therapy. And what I mean by this, and this came actually from a discussion I had with one of my team members. And actually, I've had this discussion with, I think, most, if not all, of the team of physical therapists at Sports Performance. And let me explain. So every quarter we do reviews, and like their performance and progress reviews. Like, what do you need? What do you help with? What are you really good at? How's your programming? How's your acute injury management? Like, where do you need the help? And so we kind of focus every single quarter on what's next. And some of the discussions when we start talking, I've worked with a lot of either new grads or people who want mentorship, and they're just trying to figure out, how do I become better at what I do? And sometimes maybe, the patients or the athletes, they just don't, like, they're not getting your message. They're, maybe they, like, you want them to do so much more, and they just don't, like, they don't do their homework. And I think all of us could be shaking our heads right now, but ultimately, that they can be doing more, and they're not listening to you, or maybe they don't show up to the sessions, or they don't do any of the stuff that you ask. And the question always comes up, how do I stop that? Like, what do I need to do to make sure that I'm successful and that I set up my patients and my athletes to be successful? And one of the questions, and this usually comes on usually around like month 9 or 12 after being with our company and the family, and they finally realize that we'll have a discussion. I say, I think one of the things that keeps people around and why patients and athletes like listen to you is for the same reason that you guys are on this podcast. Maybe you're looking for the education and everything else behind it, but something about our relationship, like maybe it's me, maybe it's like my kids, maybe it's my family, maybe it's you've been around my organization for a long time. Either way, something resonates with you, and people like love to be part of something that they can jive with, right? They ultimately, you jive with a certain group of people, maybe who people are. If you listen to my podcast, you're super motivated. You want to be the best. You enjoy buying the best. You enjoy like getting things done. You want to be a leader. You want to be something different than everybody else. And that's actually the truth. And I'm saying that because I've heard the feedback from a lot of listeners. And I talk to you guys. I'm like, oh, I see. We're all the same. We're like, you literally want to change the planet. You want to be the best at being a sports PT, or you want to go into pro sports or whatever it is. I get it. And so I can jive with that because that resonates with me. And maybe you want to do residency. Either way, the conversation always comes up. I can't get people past a certain point. Like, I want to keep them going, and maybe they just stop showing up, or you felt like the initial evaluation went well and nobody else is following up, or they just don't want to listen to you after like 4 months of ACL progressions, and they want to be a little bit more aggressive, or they drop off, or whatever, they cancel. And the conversation I have is, you have to remember, people stay with people. And what I mean by that is, people don't stay because of skill set. People don't stay because of your rehab progressions. People don't stay because of your manual skills. Yeah, they'll tell you that, but that's superficial. What they really enjoy is you. They really enjoy being around you. And so I titled this podcast, Don't Be a Doctor of Physical Therapy, Be You. And what I mean by that, like with the utmost respect, forget your degree. Like you guys have all worked hard. Maybe you're a student, maybe you're a new guy, maybe it's I don't care. Maybe you have a master's, maybe you have a doctorate. I don't care what you have. What I care is what you can bring to another human, right? Like, what does that mean for you? So for some of you, it's like, man, I want to get this this pitcher. They can be great, but they need to fix up their core, their mechanics, whatever it is. You'll never get to that point if you can't maintain that relationship. And you have to understand that, like, literally people want relationships. COVID showed us that, right? Like, we are now thriving. Like, we want relationships back. We want people to be in our lives. I go to a CrossFit gym, and there's no secret on that. If you follow me on Instagram, Chris Garcia DPT, I go to a local CrossFit Chula Vista. If you all want to join me, come hang out. They're in CrossFit Humanity out in San Diego. Those are family members, extended family members of sports performance, and we spend a lot of time doing CrossFit. And I've seen a lot of people come in recently over the last couple of years. I'm recording this in April of 2022, and I've seen a lot of people come back to CrossFit after 2 years of not doing it. Everyone built a home gym, and they became runners, or they went and did something different. And I've asked some people recently, like 2 people last week, I said, hey, why aren't you, like, why'd you come back? I thought you had a home gym. They're like, oh, I just miss people. Like, I need competition. I need the camaraderie. I need that. And I was like, no matter what happens, we desire community. We desire people. And that's the same thing with working with a healthcare professional or a physical therapist, that even if you say, hey, you know what, I'm going to give you the best home program so you don't ever have to come back here in 4 to 6 weeks or in 3 months, and now your knee pain is healed. That's great. However, you know what the funny thing is? They can YouTube all of those things, but they're really coming for is you. They love like being around you, not just your education, but your personality. And you can think of a couple of people, you're like, I've been trying to discharge this person, but they just love coming back. And that's the reality of like people and relationships. We're intuitive. We like love being around people. So I had recently had a review with somebody at Sports Performance, and it was a physical therapist, and they said, so what do I need to work on? And we were talking about relationships, and we were talking about some people who were, canceling or no showing or whatever it is. And I think one of the things that we talked about was early on in your career, you're trying to develop skill sets so much, right? Like that is the desire. You got a PT school and you're skill set driven. Think about this. Every con ed you're searching for is a skill set. I want to learn how to tape. I want to learn how to mobilize. I want to learn how to assess. I want to learn. Those are all skills that 100%, right? Then another part of that is like your personal like development, right? I want to become a better leader. I want to become the lead physical therapist in my organization. I want to become a mentor to new clinicians. I want to become the mentor to aspiring physical therapists. Those are like personal goals and personal development. So you have skill set that you're trying to develop, your own personal like development, and then ultimately there's one more, and that's the ability to develop relationships with others and trying to connect the two. So yes, you can work on yourself, yes, you can work on your skills, but the challenging part, the missing piece, is that you have to communicate how that's going to help somebody else. And so that's just like maintaining that relationship with that person. And so for me, on one end of the spectrum, you have some physical therapists who maybe have all the skill sets in the world. They would develop themselves, but they just can't like communicate that in a very, very simple, effective way. They just don't they don't get people. They just can't jive. Maybe they're robotic, maybe they should be in a PhD program, maybe they should be in a lab. They just don't have that. And what happens is if you develop too much skill and you work on yourself so much, you become this like fantastic doctor of physical therapy, but you can't relate to the people who like they want your service, they want to be around you. And my theory, my thought process is to tell you guys and share with you guys the success and what that brings, especially in working with professional athletes. Let me tell you, working with professional athletes, one of the most successful things of working with pro athletes is how to develop that relationship and maintain them and truly help them. Don't treat them like a professional athlete. Treat them as a person. It's the number one thing I could tell you to do before you develop all the skill sets and look at programming and like return to sport and also agility training. Forget that. Throw it out the window, because professional athletes have been around hundreds, maybe even thousands of providers. And the ones that they like and they will stick with, the ones who have the skill set, the ones who are hungry, and then the ones who can actually like talk to you and be real with you without having to, fake the, like they can tell when you're trying to get an autograph. They can tell when you're trying to get a picture. They don't want that. They just want to be treated like a normal person, and you need the skill set behind it. And they know when somebody's hungry. So the missing piece is the ability to communicate and relate with that person. So what I mean by that is, don't be a doctor of physical therapy, be you, insert your name. So don't be a doctor of physical therapy, be Chris Garcia. Don't be a doctor of physical therapy, be your first name, last name. You need to stop trying to have that white coat syndrome. What I mean is, yes, you work for that, but think of every other like doctor, dentist, any other healthcare medical professional that you've ever engaged with. The ones you really liked were like, they just had a personality, right? They were just like so great, and they had the skill set, and they just had this great aura about them, which made it jive and make it so simple. You actually like wanted to go back to to them. You're like, whether it's your dentist or whatever it is, or a massage therapist or acupuncturist, whoever it is that you go to for regular like health and maintenance. Think about why you go back, right? Like that's a homework for the week. Think about the best providers you can ever think of and ask yourself, why are they so good? Irrelevant, like irrespective of the skill set. I don't care, because I think skill set like taps out at a certain point in your life. And then your ability to like make people feel great while you help them feel amazing. That's an art. And so the thing I can tell you is, ask yourself, where or what is it about the people that you enjoy being around? What is it about it? And I'm going to tell you, it's their natural aura and their ability to make you feel great while being around them. So people are attracted to that. So yes, you are really good at your craft. You're a really good physical therapist. You're a really good master of physical therapy or a doctorate of physical therapy. That's fantastic. However, you want to turn it up a notch. Most people listening to this, so they're like, okay, I've got a good skill set. I just want to turn it up a notch. What's like one thing I can add to my arsenal? Stop being a white coat, doctor of physical therapy, Charlie Brown, wah, 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 and literally be a genuine human. Now, I have some things for you I wanted to share. And these are the things I'm sharing, literally sharing with my staff, my team. And these are the same things that I have for reviews. So here's the first one, okay? People want to work with other people. They don't want to work with just healthcare professionals. What I mean by that is, you're looking for a person, right? You're looking for somebody to help you, right? So at first you look, I want somebody to help me clean floors, right? And a carpet cleaner, right? And I'm going to look up the best one on Yelp or Google or whatever you use, whatever platform. You're going to find the best one who has the best skills, right? And the reason why you will continue using them is they have the skills. But then the real reason why you actually keep working with them is because they weren't too salesy, they weren't rude, they were just a normal human being, very appreciative, very polite, engaging. Maybe they asked you about like how long you've been here, your family, all those things, and they engage with you. That's why you're going to keep working with them. So that's just like a carpet cleaner. But same thing goes with your dentist. Every dentist does the same thing, right? Like they put the equipment in your mouth and they start asking you questions. You can't even talk, right? Like you're just like, but the real like the good ones are the ones who remember who you are, remember your family, remember all those things behind the scenes. That makes it a really cool experience. And they're not just the dentist. They're not like Dr. So-and-so. They are literally insert their first name, and that's who they are. And the minute I realized this is when I started working pro sports. I came in with the white coat, like Dr. PT, right? Like super professional. Yes, absolutely. No affect. And like, yeah, I'm going to do it. And I came with beautiful programs, and I had all these athletes in front of me, and they're like, okay, sounds good. You're just like every other healthcare provider. And what made me different was I actually had to realize the ones that I got along with naturally, those are the ones who actually had a better relationship. They had better outcomes. They listened to me more. And I realized, okay, well, wait a minute. What is it that we jived with? Is that they made me open up. They asked me questions. And I realized, oh my goodness, the ones who I jive with the most are the ones that I opened up to. And for some of you, you listen to this, you're like, oh, I'm naturally doing that. Good for you. I'm giving the strategic example for those who are still closed off, don't want to share a lot. They still think that a physical therapist is going to be looked at a certain way, and people naturally want to come see you. No, people are in pain coming to see you. They actually despise going to somebody who needs to get them out of pain because they don't want to be in pain. They just are trying to get in and out as possible. and you want to make that as good of an experience. So stop being a doctor of PT and be you. So people want to work, number one, people want to work with other people, not just healthcare professionals. Number two, here's my tip. Share your story, please. One of the coolest things you can do is ask your patient or athlete like how they got into their sport, right? And naturally, they will ask you, like, how did you get into this, right? Like, if you're having fun and you're enjoying it, they're like, how did you get into this? Don't keep it short. That used to be me, and I'm getting better at that. But you got to share your story, like everything behind it, right? So whether you were in high school or you tore something or whatever it is. For me, it's my grandma. And for those who don't know, I mean, I got into PT because I was with my grandma at a young age, and I became her physical therapist because we didn't have money for physical therapy, and she got a total hip replacement. So for me, my story is that the person who raised me, I literally gave them a quality of life back after having so much hip pain. I helped them get back to that quality of life. I helped them walk. And the irony is they helped me walk when I was a baby. So it was cool just giving back. And people value that storytelling because they literally don't know anything about you. And now they can connect doctor of physical therapy, Chris Garcia, to grandma, a passionate, empathetic human being who values people and they're here to help people, versus somebody who went to school and wanted to get an education and wants to have a career. Like there's no humane side of that. People don't get that. They don't want to jive with that. So number one, share your story. Number two, be genuine and authentic. Genuine and authentic. Be vulnerable, be who you are. And maybe not on the first visit, right? Like the initial evaluation, they're just trying to discover who you are. I'm just telling you, as that relationship develops, and I don't even want to give you a framework. Don't do this at the initial evaluation. Don't do it at visit number 2 or 3 or 4. I don't want to do that. It's got to be organic, right? Like this is like the natural human being. Like you got to discover that relationship. But ultimately, people want to be part of something bigger and make them enjoy the experience a little bit more. And they're in pain. They are here to see a doctor or somebody else who's going to fix them, but change the game. Let them experience like who you are, and be vulnerable, be genuine. Like uh, I think telling them what you're going to do for them, why you're so passionate about it, share your story, and tell them the truth. Like, I don't think this can happen. I really don't think this happened. I think this is going to be a better option for you. And when you give people those options and you're genuine, I think people will stay with you longer, and not even just because they're in pain, but maybe down the line, they have neck pain down the line and shoulder pain or whatever it is. They're going to have it. You're like, there's no doubt about that. They're going to have new aches and pains. It's just life. There will be a patient and an athlete for life. You have to understand that. Yes, you will get them pain free, but then something always pops up. Maybe they fall downstairs or whatever. Something's going to happen. And so you want them to, like, you want to be, I think we all enjoy being that point, that person who they think of, the first person they think of when they need that again, right? You want to be that top of mind, and that comes from sharing your story, being genuine, authentic, and vulnerable, and just literally telling people like why you got into it and what you plan to do for them. I think those two things are key. And here's the last one. Be interested. And what I mean by that is find out about them. I think we naturally like, well, it's your knee and it's a meniscus and you hurt your knee with a rotational, blah, blah, blah. And here's your story. I'm going to develop these exercises for you. Here's your program. Go home. I'll see you one time a week for the next 6 weeks. And your surgeon's appointment is going to be in. Like, nobody cares about that. That's boring. Like, people want nowadays, they want authenticity. They want to be part of something that it's a bigger experience for them. And if you don't inquire about them, if you don't literally care about them, they don't care about you. And now, if you want to make it transactional, that's great. But I don't think that that's what you want, because if you're listening to my podcast, it's because you somehow found the podcast, you found it kind of interesting, and there's something different for you. And if you ever come to me or one of my courses, I have a strength summit coming up in July. If you want to come to this course and you literally talk to me, you're going to find out I literally wanted to know everything about you. Why? Because I think I'm naturally generally interested on how people get to the route where they are and where they want to go. So in order for me to help you with how to develop strength training programs, I need to understand what your framework is coming in. If you've got nothing, great. How did you get in PT? How did you get to this? Because then I can understand what your frame of reference is, and then tell me what your target is, and I can understand that. But I have to be genuinely interested to make an impact in your professional development. And I get that. I get it. And I'm realizing that more than ever now as a mentor, as a coach, as a leader, as an entrepreneur. I just know that people want to be listened to, and they literally need to be, you need to be interested in them in order for you to develop that relationship. Because if you're just talking about yourself, you've heard those people, like they don't care about what the other, it's almost like you're having a conversation and they're just like, no, it doesn't matter. It's one-sided. And that's why your patients and athletes leave you. That's why they discharge themselves early. That's why they don't do their homework, is because you haven't resonated with them. That's the reality. And you might find it harder to resonate with like maybe a 13-year-old who's into their phone and they don't want to talk, but you got to be interested. You got to share a story. You got to be genuine. You got to be authentic. And I think that at that point, people break down. They're like, okay, you're a real human. Like you're not just faking it. You're not just like wearing the white coat. I think that's what a lot of the clients, a lot of the patients, a lot of the athletes nowadays I'm seeing now, even with the pro athletes. They don't want to be treated like pro athletes. They want to be treated like humans, by somebody who has the skill set and who's hungry, who happens to be a person at the same time. And so that all came from two recent reviews, progress or performance reviews, with my team. And I want to share them because I think that's real. I think that you, along your journey, you lose sight of that because you're all on skill development. Like for some of you, that's a big takeaway on this one. Like you're searching for skill development. And the reality is you're developing yourself, but then also you got to somehow mix in the relationships that you're trying to develop with people, because the more you realize it, all athletes are going to get hurt. They're all going to get hurt. You would like to be the person to support them throughout whenever their career is, or they're in college, or they're in high school, middle school. You maybe start with somebody in middle school. You know they're going to go to high school. You know they're going to like take on a new sport, or if they're in wrestling or combat sports, you know they're going to get hurt again. Like you just want to be able to be that one to support them. And the way you're going to do that is being the natural, great human you are, not the white coat doctor of physical therapy or the master's of physical therapy, whatever your degree is. I don't care. If you're a physio, you're a physio. Just don't be the physio, be you. And as I see more and more of that, you guys have to, you have to realize this, because some people aren't going to tell you that. Maybe your boss doesn't think that that's important. It actually is. And some places are going to be focused on numbers and seeing them, that many people. And if you don't see it this way, you're not going to have fun at work. You're going to be burnt out. Yes, all of us are seeing a certain amount of patients and clients and athletes, but at some point you got to make it fun, make your environment more fun and genuine, and literally enjoy the people you're around. It's an amazing journey around the planet that we're going through. So why not enjoy the ride every day? Find out more about those people. Selfishly, here's a fun fact. Selfishly, I'll ask patients and athletes one thing every single time I interact with them. I just want to learn one thing. I don't know what it is. Just tell me one thing. And so if you see me treat, when I'm on the table, I'm literally asking about food. I'm asking about new restaurants. I'm asking about what home projects you're doing. Like what's the new skill set you're reading? What's the new book you're doing? What is it that you're doing that's like keeping you motivated and everything else? And I just want to learn something so I can selfishly like take it on for me too. I learned about a new restaurant. That's the one that we went through to a date night with my wife. So it's always like what else is out there, and that's the way I treat it. Anytime I work with somebody, tell me something new, teach me something, and that for me is success and fulfillment actually. And so that makes me happy, and I want to share it with you. Okay, so that's the takeaways. Don't be a white coat doctor of physical therapy. Be you. Okay. For those who have been emailing, thank you so much for being patient. Yes. Okay. So here's the release. For some of you who've been asking, July 23rd and 24th is of 2022, whenever you listen to this, is my Strength and Conditioning Summit. This is for sports physical therapists or aspiring sports physical therapists. This is a programming course, the foundations, the fundamentals on how to get somebody, maybe you've got them out of pain and now you want to take them down strength and conditioning. Maybe don't know how to do that. Maybe you have a CSCS and you don't know how to apply it. Maybe those who are interested in the CSCS and they don't want to invest in it because it's not really pertinent to like the physical therapy realm, or some of you who have never done anything else. You're stuck in a rut, don't know where to start. This is also going to be perfect for you. So there's a couple different components I'm developing, and I'm creating for people, and it's all physical therapist based. So how do you get them from maybe they're in pain management still and you're trying to get them into strength and conditioning, or maybe they're a high school student and you have an ankle sprain and you're trying to include strength and conditioning principles to get them back faster while they rehab, or somebody who's an ACL 9 months out. What else can I do? They don't have a strength coach. They need to get back to soccer. The soccer coach doesn't know what to do. I have an opportunity. How do I do this? So that's the general framework. So put it on your calendar, save the date, July 23rd, 24th. You'll see emails coming out soon if you're on my list, drchrisgarcia.com /mailing-list. Jump on there and I'll be sending some more emails in the near future. But there you have it. For those who've been asking, thank you so much. And that is it. I will see you guys on the next episode. I hope you guys are doing amazing, crushing things, maintaining those relationships, and just being you. All right, guys. I will see you on the next episode. Take care. Bye now.